Swiss chard is packed with nutrients, offering vitamins A, C, and K, along with minerals like magnesium and potassium. It's rich in antioxidants and fiber, making it a go-to option for boosting health. However, it's not suitable for everyone. The high oxalate levels in Swiss chard can lead to kidney stones in some people and may reduce calcium absorption. For those on blood-thinning medications, the high vitamin K content can interfere with blood clotting. While Swiss chard is a nutritious choice, it's important to be aware of these concerns to decide if it's right for you. In this video, we'll uncover why Swiss chard, a nutrient-rich leafy green loaded with vitamins, minerals, and antioxidants, might not be ideal for everyone due to some surprising health concerns. Swiss chard has a lot of oxalates, natural compounds that can mix with calcium in your body and form crystals. These crystals, called calcium oxalate, are the main cause of kidney stones. Kidney stones can lead to severe pain and problems with urination if they build up. If you are prone to kidney stones or have had calcium oxalate stones before, eating Swiss chard might raise your risk of getting more stones. This risk is higher if you already have high oxalate levels from your diet or metabolism. To lower your risk, try to limit or avoid Swiss chard and other high oxalate foods. Make sure to drink plenty of water, as staying hydrated helps flush out oxalates before they can form stones. Enjoying this video? Hit subscribe to stay updated with essential health tips and the latest updates on our channel. Swiss chard has natural compounds called goitrogens. These can affect how the thyroid gland works by blocking the body's ability to absorb iodine. Iodine is very important for making thyroid hormones. If you have low iodine levels or hypothyroidism, eating a lot of foods like Swiss chard might make your thyroid problems worse. This could lead to symptoms such as feeling tired, gaining weight, or feeling cold. Cooking Swiss chard can lower the amount of goitrogens, but it doesn't get rid of them completely. If you have thyroid issues or are on treatment for hypothyroidism, talk to your doctor about how much Swiss chard you should eat. Swiss chard is high in fiber, which helps with digestion and regular bowel movements. However, people with digestive issues like irritable bowel syndrome might find it hard to tolerate. Too much fiber from foods like Swiss chard can cause bloating, gas, or stomach discomfort. Swiss chard also has fermentable carbohydrates, which can worsen symptoms for people sensitive to them. To avoid these problems, try eating smaller portions of Swiss chard, cooking it to make it easier to digest, or choosing low-fiber vegetables instead. Swiss chard is high in vitamin K, which helps the blood clot properly by activating proteins needed for clotting. While vitamin K is important, people taking blood-thinning medications like warfarin, Coumadin, should be careful with foods that have a lot of it. Warfarin works by blocking vitamin K's clotting effect, so eating too much Swiss chard or other foods rich in vitamin K can make the medication less effective and increase the risk of blood clots. If you're on blood thinners, it's important to keep your vitamin K intake steady and talk to your doctor to make sure your diet doesn't interfere with your medication. Swiss chard contains a moderate amount of non-heme iron, the type of iron found in plant-based foods. While non-heme iron is helpful for most people, especially those needing more iron, it can be a concern for people with hemochromatosis. Hemochromatosis is a genetic condition where the body absorbs and stores too much iron. This can lead to iron overload, which can damage organs like the liver, heart, and pancreas. For people with hemochromatosis, eating too many iron-rich foods like Swiss chard can make the iron buildup worse. It's important for those with this condition to monitor their iron intake and talk to their doctor to manage it properly. Swiss chard is a great source of potassium, which helps balance fluids, muscle function, and nerve signals. However, for people with kidney disease or high potassium levels, hyperkalemia, consuming too much potassium can be a problem. The kidneys help remove excess potassium from the blood, but if the kidneys are not working properly, they may struggle to filter out enough potassium. This can lead to dangerously high potassium levels, which could cause heart problems or other complications. If you have kidney issues, it's important to limit foods high in potassium, like Swiss chard, and talk to your doctor to safely manage your potassium intake. Swiss chard is low in calories and carbohydrates, making it a great choice for people with diabetes who are working to control their blood sugar. Its high fiber content can also help slow the absorption of sugar into the bloodstream, which can be helpful for managing blood sugar spikes. However, Swiss chard contains compounds like oxalates and acids, which may have a mild effect on blood sugar regulation. For most people, the impact is not significant, but if you're taking medication like insulin or oral hypoglycemics to manage blood sugar, it's important to be cautious. Though rare, some people may have an allergic reaction to Swiss chard. Symptoms can range from mild to severe and may include swelling, itching, hives, or, in more serious cases, difficulty breathing. These reactions happen when the immune system mistakenly treats certain proteins in Swiss chard as harmful. If you notice any of these symptoms after eating Swiss chard, stop eating it right away and seek medical help. Swiss chard is a healthy food that provides folate, which is important during pregnancy for fetal development and preventing birth defects. However, eating too much Swiss chard during pregnancy can have some risks. Swiss chard is high in oxalates, which can interfere with calcium absorption. Calcium is essential for both the mother's and baby's bone health. If calcium absorption is affected, it could lead to deficiencies and impact pregnancy well-being. To stay safe, it's best to eat Swiss chard in moderation, especially in early pregnancy. Swiss chard is high in fiber, which is generally good for digestion. However, for people with gastroesophageal reflux disease, the high fiber content can sometimes cause problems. The rough texture of the fiber may irritate the stomach lining and esophagus, which could trigger symptoms like heartburn, acid regurgitation, and indigestion. The natural acids in Swiss chard might also worsen acid reflux, leading to discomfort. For those with GERD, it's important to pay attention to how Swiss chard affects their symptoms. Consider eating it in smaller amounts or choosing more easily digestible alternatives. If you found this video helpful, be sure to hit that like button and subscribe for more health tips. If you have any of the health problems we discussed, it's best to consult with your healthcare provider before adding Swiss chard to your diet. Your health should always come first, so make sure you're making informed choices for your well-being. Thanks for watching, and we'll see you in the next video.